Today, two nurses, Chandler and Phoebe, will prepare a 20-year-old female named Rachel for discharge from the hospital. She's 36 hours postpartum and had a C-section. Now that she has gotten some rest and her roommate Monica has arrived, she's ready to receive information on C-section recovery and infant care before getting discharged. Rachel and Monica are literate and have requested to receive take-home materials that Rachel can show Ross, her husband.
Hi Rachel, it's so nice to see you again.
You too.
How are you feeling today?
I'm feeling okay. I'm just feeling exhausted and sore.
That's completely understandable, Rachel. So it may take you 4 weeks or longer to heal from your C-section. So we're just here to give you some information that can help you feel comfortable and prepared on your way home with your new baby.
Okay.
All right, so after a C-section, you are at a higher risk for infection in comparison to individuals who have vaginal birth. So while the incision heals, make sure that you're not doing any excessive exercise, that you aren't lifting anything heavier than baby Emma, and also make sure that you're wearing loose clothing, nothing tight over the incision. Okay? And do you have anyone to help you with the errands or chores at home?
I can help with the chores and the errands, and I also brought some loose clothes for you.
Thank you so much, Monica. She's been my main support since my husband Ross got called on a business trip right before baby was born. So
Well, it looks like you've got a great support system right here. Monica, if you can help her out while the incision is healing, that would be wonderful.
For sure.
about my incision, what can I do about my pain?
Lower abdominal pain is common in women who've had C-sections. You may want to use pain medication such as ibuprofen or Advil for 1 to 2 weeks. It's also important to consume foods high in fiber, such as fruits and vegetables, and make sure to drink plenty of water to avoid constipation.
Okay, I'm also just wondering when I can expect my bleeding to stop.
Vaginal bleeding usually continues for about 6 weeks, so it's best to use a sanitary pad rather than tampons, and try to avoid sex until your doctor says it's safe to do so. If you are passing clots that are larger than a quarter, or if you've got any discharge from the incision, call us right away. And do you know how to recognize the signs of infection?
Yeah, I think so. It's like any extra pain, redness, pussiness, right?
Exactly. Yeah, and if you do notice any of these signs, do give your doctor a call. And when you're showering, when you're drying off, make sure that you're patting the site rather than rubbing. And don't use any lotions or creams or oils on that site either. Yeah. Do you have any other concerns?
No, that all makes sense to me, and a breastfeeding specialist already came to talk to me as well. However, no one's talked to me about sleeping yet, so I'm just wondering what other info you guys can offer me with that. I already have a crib and a bassinet at home, and I kind of just want her to sleep with me in my bed until my husband gets home. Is that okay?
Yeah, so that's great that you already have a crib and bassinet. Are you aware of some of the risks associated with sleeping with your baby in your bed?
No, I didn't know that was dangerous.
Yeah, so research actually does not support co-sleeping, as it can increase your baby's risk of sudden infant death syndrome. Have you heard of that?
I have heard of that. I just didn't think that co-sleeping was a risk factor.
Yeah. So instead of co-sleeping, we actually recommend that Emma sleep in her own crib or bassinet, and you can put it right next to your bed. So having her really close to you will support the bond between the two of you, and it'll also make it easier for you to respond to and learn about Emma's feeding cues. And then lastly, it's also a lot easier for you to feed because she's still really close to you.
Okay, that all sounds totally doable, and she'll still be close to me, so I like that.
You can expect Emma to sleep around 16 hours per day. This is also a good time for you to get some rest, which promotes healing for you. Don't put anything extra in the sleeping area, including blankets, pillows, and toys. The crib should have a firm, flat mattress with a tight-fitting sheet. It's also important to put Emma on her back when she's sleeping. And if she needs a blanket, ensure it's firmly tucked in on all sides and up to Emma's chest, but make sure that she does not overheat. Breastfeeding and pacifiers are also shown to reduce the risk of SIDS.
Okay, great. I really appreciate all this new information as a new mama.
Good, I'm glad that we've been able to help. So lastly, I know that we went over Emma's initial bath earlier today, and you were able to learn some things at that point, but do you have any other questions regarding bathing?
I'm just wondering specifically how often should I be bathing her?
Yeah, great question. So Emma should be bathed every other day, and baths should be around 7 to 10 minutes in length. And this should be done before you feed her as well. We do recommend using a soft cloth and soaps free of any dyes or fragrances as well. And never leave baby Emma unattended when she's in a bath, and cover her up to avoid hypothermia.
Okay.
Yeah, do you have any other questions?
No, Monica and I really appreciate all the information you two have given us today.
Thank you so much. Good, you're so welcome. I'm glad that we could help. We've gathered some resources as well for you to take home. It just summarizes what we talked about today. And if any other questions come up, just don't hesitate to give us a call or give your primary care physician a call.
Thank you.